Hi, I'm Kristen Connect, and I'm an orofacial myofunctional therapist. And you probably received my information from a dentist or an orthodontist that believes that form follows function. Now, what does that mean? That means that as our bodies are growing and developing, if we are functioning properly, then our bodies will form properly. But if we are not quite functioning properly, then our bodies will try to compensate for that, and malformations will happen, which can then cause further and further problems later on in life. So people come to me when their dentist says, hey, I can help you fix your teeth or your jaw or help you with your tongue or things like that. And they can do a surgery and give you an appliance to wear or put braces on you and fix the form. However, if the functioning is incorrect, then, or the function is incorrect, then things will start to regress back towards the improper form if after the braces are removed, after the appliance is done, after the surgery is healed. And so I've got a little presentation here that goes into why it's so important for you to do your part along with the dentist doing their part. So let's get started. All right. I am president of Head, Shoulders, Teeth, and Tongue, and I do call it that because all of this area is connected. Now, I'm in a really small screen off to the side here, but when I say all of this, I'm talking about the entire body, but I am working with the head, neck, and shoulders. And so as you're going to maybe a chiropractor or a massage therapist or a craniosacral therapist, they can do a lot to align things. The dentist can fix things via appliances or surgeries or other things we've talked about, and they will help you kind of feel better for a little while. But if your body isn't functioning properly and your posture is incorrect, your tongue posture is incorrect, you're not breathing through your nose most of the time, all of these little things add up, and these improper habits can really work against you. So I love starting out with this photo. These are two Olympic runners about to win gold and silver in the 400-meter relay in the Beijing Olympics. Sonia is running for the US, and she is about to win gold. Now look at her face. She looks focused, calm. She looks controlled. Her head is up and balanced. Her shoulders are up and back. Her chest is up. Her mouth is closed, and she's breathing through her nose. Now, she's learned myofunctional therapy and Buteyko breathing and has been breathing this way for years. And if you look at her competitor from Russia, whose name I can't pronounce, so I'm not going to try, she's about to win silver, which means she's also an amazing individual. However, her chest is sunk. Her shoulders are crowded and forward and hunched, and she is off balance. Her jaw is slack. She's breathing through her mouth. She looks like she is working so much harder than Sonia and doing the same exact thing, which just goes to show that our bodies are amazing. We can compensate for a lot of different things that are going on, and we will survive just fine. In fact, looks like she's thriving pretty well, but she's expending so much more effort than Sonia is. And so if we can train our bodies to have the proper habits, then we can focus the energy that we have on those things that matter, and then we don't expend so much on things that are working against us in our own bodies. So what is orofacial myofunctional therapy? It is literally physical therapy of the face, mouth, and neck. And this question, why does everyone seem to need it these days? That should probably read, why does Kristen think everyone seems to need it these days? And there's a couple of pictures here to kind of show some open mouth posture. We've got a tongue that is tied down to the floor of the mouth too tightly by that lingual frenum. Everyone's got a lingual frenum, but if it's too tight, it's going to inhibit that tongue from doing everything it can do. So other pictures of an open bite and a cross bite where the teeth have shifted in towards the mouth, closing that mouth off, closing that airway. And this last drawing is of a tongue that is sitting too low in the mouth. And there's a number of different reasons that can happen, but this particular drawing is of an artistic rendition of a tongue tie. And there's just so many things that go on as far as our bodies functioning correctly. And so if everyone knew how to breathe properly, chew properly, swallow properly, and hold their posture properly, then we would function so much better, and our bodies would form properly, and it would just be, a little easier to live. The goals of myofunctional therapy are the first four on this list: breathing, swallowing, chewing, and then rest posture. And the reason I put articulation is because it's last. That is something a speech therapist would do, or a speech pathologist can work on. But I've worked with speech therapists who have had orofacial myofunctional therapy training, and they understand that if you work on the breathing and the swallowing and the chewing and the tongue rest posture first, then oftentimes those articulation issues kind of fall into place because the tongue is doing what it's supposed to be doing with the basics. And if you work on articulation first and the tongue isn't doing what it's supposed to be doing, 99% of the rest of the day, you're working backwards, and it's very difficult. All right, I would like to point out that I am an orofacial myofunctional therapist, not a fascial therapist. Now, fascia is the connective tissue, and this is very important because we do work with it a little bit, but craniosacral therapists are the ones that work with this. Massage therapists or chiropractors often work with this. When a doctor releases the tongue tie, cuts through that connective tissue, they are releasing fascia. Fascia is just another word for connective tissue. Now, the cool thing is that connective tissue or fascia is connected from head to toe. And so when when it's too tight in one area, like underneath the tongue, then it prevents the tongue from doing what it's supposed to do, but the tongue is going to try to do it anyway. And it's going to fight and pull against that fascia constantly, every time you swallow, every time you try to breathe properly. And that tension creates further tension all the way back into the jaw and towards the back of the neck. It goes straight back. And so a lot of people have a lot of tension in their jaw joints, have a lot of tension in the base of their head, the upper part of their neck, all because the fascia is just too tight and it needs to be released. So we work with it a little bit, but that is mostly the doctor's job when they are releasing the tongue tie, or a craniosacral therapist job to help kind of massage it. And a craniosacral therapist, some of them claim that they can release a tongue tie. I've not seen it happen long term. They seem to be able to loosen it some, but unless it is cut, especially for adults, it tends not to last very long. But cutting it and then stretching the tongue does allow a person to grow extra fascia in between so that the tongue is not tied down anymore, and it has the length of that lingual frenum, which is the technical term for that tongue tie. It has the length that it needs in order for the tongue to do what it's supposed to do. Okay, this is super important even for babies. Now, I don't work with babies. There are lactation specialists, board certified lactation specialists who are also orofacial myofunctional therapists. I've got some great referrals for anyone who has a baby that wants them checked out. But I will just briefly talk about how this can start with just the child being an infant. If their tongue is tied down and it is not caught, then oftentimes the mother really has trouble breastfeeding. If the child, maybe can't be breastfed for whatever other reason, and they must have a bottle, the tongue will actually learn something called low tongue tone or low tongue position. And both of those, low tongue tone and low tongue position, can cause further issues in the formation of the mouth as the child develops. And so all of these little things start from day one. And sometimes they don't start from day one. Sometimes the baby is just fine and they breastfeed just great and they don't have a tongue tie. And then later on something happens, and then things start to kind of shift as we take on compensations. And I'll explain a little bit more of that later. Okay, a little bit more about fascia, and just that fascia is covering us from head to toes, and it even covered in between our fingers. So when we were in utero, all of our fingers and our toes were webbed together, And then at some point before we were born, body said, okay, all cells in between the fingers and toes need to die so that all of our fingers and toes can be separate. Well, the same thing is supposed to happen underneath the tongue, but for some reason, sometimes it stops early or it doesn't happen at all. And that extra tissue there just remains there until we find it and release it. And that's in the case of a tongue tie. If you don't have a tongue tie, you don't have to worry about that. But there's another link on here that goes even more into the fascia connection. And so if you're interested in learning more, you can definitely take a look at that, copy and paste that into your browser. Here, just wanted to point out that fascia is often the thing that is causing us to have forward head posture, or a closed off airway has an influence on this as well. If someone starts to slouch, they might be slouching because they're trying to bring their head forward and open up their airway, and then they feel the need to continue to do this. But as you can see, that increases the pounds of pressure that it puts on the spine. And so that's not a great situation to be in. And so we want to correct posture, we want to correct mouth posture and correct mouth habits and breathing habits. And as we do all of this, then everything is going to be much more nicely aligned and will stay that way even after you get an adjustment from the chiropractor, or even after you see a craniosacral therapist. They can help you adjust, but then your muscles need to learn how to hold that adjustment. This is just this is Einstein. He's engaging his transverse, vertical, and genioglossus muscles. So now every time you stick your tongue out, those are the muscles you're working first. This little artistic rendition here is really important because it shows that the face ought to be pretty symmetrical and that the proportions of the face can be blocked out mathematically. And this applies across nationalities. It does not matter where you come from. The face ought to have proper proportions, and those proper proportions, those having 1/3 for your forehead, 1/3 for your nose, 1/3 from the base of the nose to the chin, and then those 1/5 all the way across, and having the face match, be symmetrical, means that the formation of the face inside, or the whole skull inside, and the airway here, starting from just behind the mouth and just behind the nose, that is all in proportion as well, or it's highly likely that it is. Because if the math works here, then it works all the way through. And it's important that we talk about these kinds of things, because that's what we're often looking at as dentists and orofacial myofunctional therapists. And so I just want to kind of point out that if the math works out, and that's often what an expansion appliance will help to do. If you are getting expansion appliance, then it may mean that the roof of your mouth is quite narrow, and that will elongate your face this way, but it means that you might not be getting as much forward growth movement or width. And both of those can impede on the airway inside. All right, I love this example. These are actually Dr. John's patients, and he's a really amazing orthotropic doctor, which is basically orthodontics, but he was over in Europe. And he had his patients learn to close their mouths, breathe through the nose, put their tongue up at the roof of their mouth, and then he would put braces on them if they needed it. And we have two sisters here who saw the same dentist, same orthodontist, for their orthotropic treatment, which was braces and learning proper habits. Well, the older sister, Sam, refused. Her parents tried to encourage her to learn these new habits, and she just didn't care. She just didn't want to focus on it, didn't want to worry about it. And if you have children, that you can try to encourage them to do things correctly, but if they're refusing to listen, then they're just not going to do it. Her younger sister, Kelly, made a big effort to keep her mouth closed, to breathe through her nose, to keep her tongue in proper position. Well, at the end of orthodontics for both of them, you can see Sam has what's called facial strain, or elongated long face syndrome, where her jaw down here is longer and narrower. In fact, she was asked to close her lips for this picture. Her lips actually usually just sit open like they were in the first picture. And but when she was asked to close her lips, we can now see the facial strain that is happening. And her younger sister, same orthodontics, same orthodontist, but she learned correct habits. Her facial forms fits the math. Another formation caused by poor oral posture is the cheekbone. So our cheekbones are connected to the roof of the mouth via a couple of different connections, and those get stimulation by proper posture and proper chewing and proper breathing and proper swallowing. And so if we're not doing that, then we can start to look more like the person in the middle or the person on the right, as the cheekbone just doesn't grow enough, and it doesn't grow enough to support the eyes, which actually kind of makes the eyes look a little bit droopy and can eventually lead to something called a hooked nose. It just means that the nose is kind of longer and not very supported, and so it's got this kind of a hook or bend in it. This picture right here talks a little bit about the jaw angulation. So we've zoomed out just a little bit to take a look at the bottom jaw or the mandible. And you can see the first person on the left has a mandible that looks like it's about 90 degrees. And this person has been keeping their mouth together. Their jaw is wide. You can't see that from this perspective. This is a profile, but their jaw is wide enough to hold all of their teeth, and so it is angled at a 90-degree angle to hold all of that mouth in there. Someone who's breathing through their mouth a lot or keeping their tongue low in their mouth is not going to get that widening of the jaw, and so the jaw will start to lengthen instead. And so the problem with that is that the jaw is actually inhibiting the airway, and it's making the roof of the mouth narrow as well. And the roof of the mouth is the floor of the nose. And so if all of that's closing up, then it's very difficult to breathe through the nose. And then we're missing out on all of these benefits of breathing through the nose. This is just to summarize here. You can kind of see which child kind of matches up with the other drawings and how well their proportions fit, how well Kelly's proportions fit and Sam's proportions don't fit so well. And so Sam is going to run into other issues later on in life as far as breathing and swallowing, likely. Might even, result in things like snoring or upper airway resistance syndrome or sleep apnea or things like that, all because her jaw did not form correctly, and now it's impinging on the airway. I was pointing out earlier that the cheekbone does not form properly, and so it's smaller and doesn't support the eyes. And you can see that the eyelids are drooping in these children, and that the eyelid is not touching the colored portion of the eye there. It ought to touch the colored portion of the eye, unless we're surprised. This child here was taught orofacial myofunctional therapy when he came in, and at first he was breathing through his mouth. He had poor, slightly forward head posture. Not too bad though. Still very young. Still had a lot of growth left to do, which is great. Caught it early, and he took the exercises seriously. Became aware of his mouth breathing, and really focused on nasal breathing and chewing properly and swallowing properly. And I keep emphasizing all these things, but as we learn to do these properly and we become aware of our improper habits, then we can really see some amazing results. He just looks more alert. His cheeks are a little bit higher because the cheekbone has grown a little bit more, even in just the few months that he did this. And that's what happens often in children, is when they really focus on it, children can see quite a bit of change really pretty quickly, whereas adults often need an appliance to help them catch up since their face has fully formed. But this child's face hadn't fully formed, and so after several months of myofunctional therapy, keeping his mouth closed, breathing through his nose, chewing properly, swallowed properly, strengthening his tongue, doing some other exercises, you can see he looks more alert, his eyes are more awake, and he just looks healthier, which is awesome. This is a CT scan, an X-ray of an airway. You can see where the green and blue crosshairs they are crosshairs. The airway is quite narrow right there. And then you can also tell, I'm going to use my mouse here, that there is a dark space. This is the tongue. These are the front teeth. These are the lips and the nose, just to give you kind of a layout of what's going on. This is the roof of the mouth. It is also the floor of the nose. So if the tongue is sitting low and it's not sitting along this whole area here, then that person, their tongue is sitting lower into their airway. That tongue is going to fill space somewhere. And if it's not filling the mouth, then it's going to fill the airway. It doesn't get smaller because the space is smaller or because it's not sitting where it's supposed to be sitting. And so if we can train that tongue to sit where it's supposed to be sitting, then we're going to open up the airway just by doing that. Then we tone the tongue and it opens up the airway even more because the muscle of the tongue actually extends further down than what we can see just by looking in someone's mouth. And so as we tone this whole tongue, we tone the whole tongue all the way down the throat. These two pictures over here of these children's mouths, they are in what's called crossbite, where the upper teeth on one side are sitting inside of the lower teeth. And upper teeth are always supposed to sit on the outside of lower teeth. And so if they're sitting on the inside, that means that these mouths are very small. And that means the nose is very small. And that can also mean that the airway is very small. And so when we see someone in crossbite like this, we start asking questions about sleep. Is the child sleeping all the way through the night? Are they waking up in the middle of the night? Are they wetting the bed? Are they breathing loudly? Are they snoring? Are they, tired in the morning, even though they've been sleeping all night? All of those are signs that they're not breathing properly because they can't get the oxygen they need because their mouth is too small, and that's causing their airway to be too small. I love this picture so much. This is an ancient skull. It is so beautiful. Just look, it's got 32 teeth. This person didn't need any of their teeth extracted. And as far as I know, they didn't have dentists and orthodontists way back when. But they have this beautiful arch of teeth, 32 teeth. Oh, so pretty. But they all sit in alignment and they didn't need any help doing it. Probably because they had to chew through all their food. Even people today who are eating all organic, they're blending all their food. They're cooking everything, which makes it softer. They're chopping it up into tiny little bite-sized pieces, and they're depriving themselves of all the muscle and bone stimulation that they would get from chewing hard foods. So that is definitely something that we go over in myofunctional therapy. And we make sure that you are chewing your food thoroughly, that you are chewing hard foods regularly, and if the face is still developing, then that can help so much. Now, the bottom picture here applies to a study that was done on rats by Dr. Ono over in Japan. And he had two groups of identical rats. And one group had a normal diet, which was made of hard pellets that had all the nutrition that they needed. And the other group of rats had the same food, but they were pre-softened. Everything else about the rat's environment was the same. And at the end of this study, the rats they compared the femur bones of these rats, leg bones. And it showed that they had the same length in femur bone and they had the same density in both sets of femur bones. But which goes to show that neither of them was malnourished. Neither one avoided their foods or didn't have enough food or anything like that. Both groups were given the same amount of food and the same amount of play and all that stuff. And so their leg bones grew properly. Now, when it came to their jaws, the group that had the normal diet or the hard pellets to chew through, their jaws grew the proper length and the jawbone density was very good. But the group of rats that had these soft or pre-softened foods, their jawbone was much smaller and the bone density was much less. And so it just goes to show that even if you have all the nutrients that you need, if you're not given the stimulation that your body needs to grow, then your body is missing out on that opportunity to grow properly. All right, so orofacial myofunctional therapy. We focus on exercises that help the jaw grow, that help the tongue tone, that help people breathe through their noses. And it takes a while. The older you are, the longer it takes, up until about an adult. And then for most adults, it's about the same. And I'll go over that briefly at the end. But as we tone the tongue and teach it to sit in proper position, then we can teach that tongue to stay out of the airway, to open up that palate, to stimulate further growth of the jaw, and to get those teeth to come in place where they're supposed to be. That's the tongue's job, is to guide the teeth into place properly and then to keep them clean after they're there. This right here is an X-ray that shows what happens after a person does these exercises. We've got an airway that is quite narrow in the X-ray on your left, and an airway that has opened up after doing exercises for several months, which is really so cool because it's all connected. So as you do your exercises in your mouth, it is opening up all of what we call the oral pharynx, which is just this whole complex from front to back. I have to give a shout out to Dr. Zoggy, who is an amazing ENT. That's an ear, nose, and throat specialist. He is on the cutting edge of this surgery frenectomy, which is the tongue tie release. That's the official term. And he's got a link on here that's over an hour long that is just fantastic as far as the science behind why we do what we do and why we're recommending releases of those short lingual frenums if necessary. And so anyway, I put that on there just in case you wanted even more information on that. He does talk about how when the tongue is low in the mouth, and that can happen because the tongue is being held down by the lingual frenum that is too short, or it can happen when someone gets really stuffed up nose for a while and they have to breathe through their mouth. The mouth is the emergency breathing opening, but we shouldn't be using it unless it's an emergency. It's mostly for the entrance of food, not air. The nose is what we use to breathe. Why? Because the nose filters the air, it humidifies the air, it warms the air, and when our tongue is held in such a way that it is filling the whole mouth, including touching the roof of the mouth, and we're breathing through our nose, that actually stimulates the production of nitric oxide. Now that's not nitrous oxide, which is laughing gas. Nitric oxide helps oxygen get to where it needs to go. So it's really, really great to breathe through your nose. And also when our tongue is held to the roof of our mouth, it actually produces feel-good hormones, and it helps to soothe us. That's actually why babies like to suck their thumb. They're pressing their thumb up against the roof of their mouth. And it's a very soothing and calming feeling to breathe through one's nose while pressing one's tongue or one's thumb up against the roof of that mouth. The problem is if the tongue is sitting low in the mouth, then those teeth, as you can see from this drawing of the skull, don't get the pressure that they need from the tongue. And so they will not grow out, but they will sit narrow. And that means that the palate or the roof of the mouth is narrow. And that means that the floor of the mouth is narrow. And that means that if you're breathing in allergens through your nose, and then your nose kind of swells up to try and filter that out, and it starts producing mucus to filter that out, well, any little bit of swelling or any little production of mucus is going to close your nose up right so fast because it's already small to begin with. But if your nose is open and wide as it should be, then as you're breathing in those allergens and your nose is doing what it's supposed to be doing to filter all that out, and it's reacting to the allergens before they get to the lungs, which is its job, then even if the nose swells a little bit, or if it produces some mucus to try and capture those allergens before it gets to the lungs, you can still breathe through your nose because you still have more space. But if everything's really small, good luck. So we want to open all that up and give you the space that you're supposed to have, and then keep it there. Dr. Guilleminault, he recently passed away, but was on the cutting edge of defining things like the apneic-hypopneic index. You've probably heard of sleep apnea. He's the one that defined what an apnea is. And he found that people who breathe through their mouth, it causes local inflammation in their mouth, in their oral tissues. It dries out all the tissues. It can cause inflammation of the adenoids or the tonsils. That blocks off the airway even more, so the person can't breathe through their nose and they have to breathe through their mouth. And then it increases their UA resistance, which is upper airway resistance, which leads to abnormal facial growth, postural maladaptations, meaning forward head posture or other things in order to cope with what's going on, further systemic inflammation, and then all of those abnormal oral facial growths lead to more mouth breathing. And it's just a vicious cycle unless we stop it. We figure out what habits aren't serving us, we becoming aware of those, we stop those, and we increase our good habits so that we can increase our proper formation of our face. Low tongue posture. I want to go over this because I hear a lot about cutting tongue ties and things like that. We don't cut a tongue tie unless it is functionally causing a problem. There are many reasons why a tongue will sit low in the mouth. And this right here is a CT scan. These are actually the nostrils and the turbinates where the air is supposed to flow through. This person's nostrils are actually quite swollen. And then this is the floor of the nose or the roof of the mouth. And then this little space here, this is nothing. There's nothing in there. There should be the tongue, but the tongue is sitting low in the mouth right here. And then here you've got molars on each side of the face. So it's as if we cut you down this way and took a look and opened you up and took a look. But this tongue is sitting low and it's not putting the pressure that it needs to against that palate or that roof of the mouth. And that could happen because of a tongue tie. If that lingual frenum is too short, then it's going to hold that tongue down. And it's going to be very difficult for that person to keep their tongue up. They might be able to force it up there, but as soon as they stop thinking about it, as soon as they go to sleep, that tongue is going to come back down. But it could also be because of mouth breathing. And there's various reasons why a person might be mouth breathing. Illness, they just don't know any better, allergies, tongue tone. Sometimes people just kind of have low muscle tone, and so we really need to build up that tongue muscle. That's what physical therapy is for. Tongue space. So when this mouth is small, it's too small for that tongue, the tongue keeps growing, but the mouth isn't because the tongue isn't positioned properly to help that growth, then that space stays small. And then it is shoved down into the floor of the mouth. When the space is small up top, the tongue is shoved down. Other fascial restrictions, which is, you could go to a, massage therapist or a craniosacral therapist to help with those fascial restrictions that might be elsewhere in the body. But if we're seeing it in the tongue, we're going to recommend that you get it taken care of. Forward head posture causes open mouth a lot because we're holding our airway open by holding our head forward, and that encourages us to open our mouths. And there are other myofunctional disorders as well. But anyway, tongue tie is only one of them, and so we do check for that when we're seeing low tongue tone, but it is not the only cause. And so we are all aware of that in holistic dentistry, and we don't want to be doing surgery if we don't need to. All right, this picture, I do share it because this patient actually had their tongue tie released 3 times by 3 different doctors at 3 other offices before they came to us and said, hey, when I close my mouth, I can't get the back of my tongue to stay up on the palate like I've been taught to do. They had been going to an orofacial myofunctional therapist. I can't get my tongue to stay up. I've had my tongue tie released 3 times. I'm coming to you guys now. What can you do it? Like, can you do it better than they did? And we took a look inside his mouth, and you can see he can raise his tongue all the way up to the roof of his mouth while expanded completely. In fact, you can try that yourself. You open your mouth all the way, Then you bring your tongue up to the roof of your mouth. If you have to close your mouth in order to reach the roof of your mouth, then you might have some tongue tie going on. You might have some what we call tongue restriction going on. This person does not have that kind of restriction going on. This person's teeth are very narrow. That means their palate is very narrow, and that palate is very vaulted as well. And so this person, they can't keep their tongue up because there's no room. It's squished into that little tiny space. And so this isn't a tongue tie restriction. This is a tongue space restriction. And there are neuromuscular dentists who are fantastic at working with expansion appliances, even for adults, that can give you the space that you need in order for your tongue to do what it's supposed to do and allow you to breathe better and thus sleep better and all the things that, ripple out from there. It can take a village. Kind of depends on what you're being diagnosed with or what you are going through. But if someone's got a major sleeping issue, meaning sleep apnea, then they're probably going to need a sleep test, and a neurologist is what's going to read that. Or if they have nasal polyps or a deviated septum, then they need to see an ENT. Myofunctional therapy is not going to fix that. If they have really bad allergies and their tonsils are inflamed, maybe they should figure out what they're allergic to and fix that. If they're a baby, they need to see an international board certified lactation specialist. That's what IBCLC stands for. And then there's all these other specialists as well that can help. And if we see a need for that, then we may suggest that you go see one of those people. But regardless, you need to start working on correcting your own habits so that as these other things get fixed, like I've been talking about, you'll be able to keep things corrected and it won't regress back to where it's been. I love this study. There are several studies out there on myofunctional therapy. This one is a what's called a systematic review and meta-analysis. A meta-analysis is the highest form of scientific study. It is an analysis of other studies, and it showed that myofunctional therapy provides a reduction in apneic-hypopneic index, or sleep apnea, of approximately 50% in adults. So some people even more, some people even less. So on average, 50% and 62% in children, right? Because their faces are still forming. And so as they learn to function better, their face will form more properly, which is huge just by itself, without anything else, without any surgery, without any appliances. 50% in adults, 62% in children. Pretty amazing. It helps to improve daytime sleepiness and snoring, which makes sense. If you're breathing better, probably sleeping better, and you're probably not snoring either. It's shown to be effective in children and adults in all ages that studied thus far. They've studied as young as 3 years old. 3-year-olds are a little tricky to work with, but if they can follow instructions and they are willing to do the exercises, then they can see results very, very quickly. I tend to work with ages like 4.5 and up, just because age 3, they tend not to really understand why it's important to do these things, but we can do some basic things for them, and they can see some improvement that way. And then it's important in preventing relapse. Now, I've talked about this before, but what that means is anytime you're using an appliance, or you get a surgery done in the mouth, or you're getting braces, or something of that nature where we're fixing the form, we also need to fix the function. Just fixing the form does not fix the function. The function is the habits, whether they're good habits or bad habits, meaning the habits that work for you or habits that are working against you. If we create good habits that are working for us and helping us breathe and helping us chew and helping us swallow, then all of that hard work that your dentist put into your mouth is going to stay that way. It's going to last much longer. You're going to see much longer improvement overall if you're doing your part along with the dentist doing their part. I love this picture right here. It says GOPex here. That stands for Good Oral Posture Exercises, and which is basically the same thing as myofunctional therapy exercises, but these patients were seen by a doctor who liked to call it GOPex. Anyway, it's really pretty amazing how this 3-year-old did these exercises, and after 30 days, we can already see he has better posture, and his eyes are a little more alert, and his cheekbones are even just a little more prominent. They're supporting those eyes. And these other children as well, they are growing their jaws, and they're opening up that airway. They're breathing through their noses, and they're growing their jaws out this way as well. We only have profile pictures again, but as they grow this way and they're not growing elongated, they are also growing this way, which is really pretty amazing, all from stimulating proper habits and getting rid of poor habits. Just a few more examples of what can happen with assisting proper development of the face and airway. I love this picture because this child looks like he even has an allergic shiner under his eye. That's called venous pooling, and that happens when the jaw bones are not stimulated to grow properly, and so that blood is being allowed to pool in the skin there. And then his chin, you can see there's a crease in his lip where his lip kind of dips in towards his chin there. That is a sign that the chin is not growing further forward and elongating enough, right? You don't want to have a super short chin. And so when I say elongation, I'm talking about extra elongation. Everything should be in its proper proportions. And so as he practiced his myofunctional therapy, that chin grew forward, it grew into the proper density and width and length, and his face is much more supported by all of the bone because he exercised the muscles, which is really pretty cool. Muscle grows bone. All right, these are the phases of treatment in general. And you can see here it says about 22, that's referring to visits. So let's go back to the beginning here though. It says intensive phase, 8 to 10 weeks. So if you have a tongue tie, then I'm probably going to recommend that we see you for at least 20 visits. Those first 10 are going to be weekly. Then if you don't need a tongue tie, the first 8 will be weekly, depending on what's going on with your jaw as well. If you have jaw issues, I have a couple of other sets of exercises that we do specifically to make sure that the jaw is stable, that we're not going to cause it any further pain. And some things like that. We definitely don't want to get started in this before we know your jaw is stable. So if you're feeling jaw joint pain, I'll be asking you about that, and we'll definitely be starting with some jaw stabilization first. Okay, after the intensive phase where we're meeting on Zoom every week, going over these exercises, they each build one on the next. And so you've got to do the whole week worth of exercises, and then you meet with me, we go over them, I check your technique, check to see how you're doing, and then we go into the next set of exercises. And I do change these up. They're not just, a set for everybody. Not all of these work for everyone. And so, but I do start with kind of a basic set like you're seeing here. And then as I see what's going on in your mouth, I definitely change things up. The next phase is the generalization phase, where I'm meeting with you twice a month, once every other week. And so you're doing the exercises every day still. In fact, you're doing all of these exercises 3 times a day. So if you are not in a position where you can commit to doing exercises 3 times a day, and they take 10 minutes each time, so that's 30 minutes out of your day every single day, even if we're meeting once a week, once every other week, or once a month, then maybe we wait until you're ready to do that, because you've got to commit to this, you've got to do the work, or it's not going to happen. Just showing up to the Zoom session doesn't do anything. And then here it says once every 3 weeks. This is kind of an older slide. I actually meet with people once a month at around session 12. And then I usually just do 20 sessions or 21 sessions. And anyway, check your email for what we're planning on doing for you and what would be recommended for you. Most people don't need 22 unless they've needed a repeat session or something like that for whatever reason. Anyway, That is my presentation. This is Head, Shoulders, Teeth, and Tongue, and I'm excited to meet with you, answer any of the questions that you have. You probably have some questions now. I also have some books that are really great. They can go into even more detail on what might be going on in your particular case, and you can ask me for the names of those. And I'm super excited for you and your journey to live a more functionable life.